Hi, I'm Femi OK. Welcome to the Home Edition stream. Now, typically in the United States and Canada, if there's a mental health emergency, the police are called. But let me show you the worst case scenario that may well happen. I'm going to take you to San Diego 4 years ago when the sister of Alfred Olango called the police because her brother, who had mental health issues, was acting strangely. This is what happened.
Life is frozen. Okay, so the police did it again, y'all. They shot another unarmed black person, as usual. And the lady is saying she called them for help not to kill her brother, and they shot her brother.
I called for help, and he called you guys to kill him.
Do you hear this? She called for help. She did not call for them to kill him. What's his medical history so they can make sure not to give him anything?
What's Alfred's last name?
Olango.
Okay,
G.O.
And what's his birthday, hon?
I can't think. You killed my brother in front of me.
She can't really think about it right now.
On this episode of the stream, we ask, are the police the right people to call in a medical health emergency? And if we don't call them, who do we call? This is a conversation I know you have input on. If you're on YouTube, we'd like to hear from you. Share your stories, your experiences, your questions for our panel, and you too can be part of the conversation. I will say hello to the guests. The guests will introduce themselves to you. Asante, it is good to see you. Tell everybody who you are.
Hey everybody, my name is Asante Houghton. I am a mental health advocate and the co-founder of the Reach Out Response Network in Toronto, which is an initiative we're trying to bring to the city to do rapid response, peer-led mental health crisis intervention. Beyond that, I wear a lot of hats. I am a peer worker myself. I train peer workers. I have a couple of TED Talks out there. I host a web show called Cypher, which blends music and mental health. So a lot going on.
All right. I'm looking forward to digging into a lot that you have going on. Hi there, Tim. Welcome to the stream. Introduce yourself to our international audience.
Good morning. My name is Tim Black. I'm the Director of Consulting at Whitebird Clinic. I'm also a former Cahoots crisis worker and administrator. I spent 10 years responding to calls out in the community and working to support the day-to-day operations of the Cahoots program. And my current focus is conversations and work with other cities as they explore implementation of programming based on the Cahoots model of mobile crisis intervention.
Fantastic. Now, people who work in mental health and people who work with the police know exactly what Cahoots stands for. Do you want to unpack that acronym for us, Tim?
Absolutely. Cahoots is an acronym standing for Crisis Assistance Helping Out on the Streets. The Cahoots model is a mobile crisis intervention response that's integrated in public safety, where all the calls for service are routed through that public safety dispatch. So those mental health response teams that you see with Cahoots are responding to calls the same way that the police or fire department do.
Thank you so much. Hello, Sergeant. Last but not least, tell everybody who you are.
I'm Amy King, and I'm a sergeant with the Olympia Police Department in the state of Washington. I've been with OPD a little bit over 20 years. I've had a variety of different roles during those years. Currently, I am in charge of our downtown walking patrol and have been involved in the last couple of years of creating a mobile crisis response unit here in Olympia and another program we have, Familiar Faces. And our crew response, our team is based off of the Cahoots model.
Amy, I'm just thinking, and really same thought for all of the guests, is why are the police called? Why are they asked to come to a mental health emergency? If I broke my leg, I wouldn't call the police.
Right. As it stands right now, we have 911. We don't have 912. And so although there are places like in Eugene where Tim is from and where up in Toronto, I think is where Asante is from, and programs starting, and there are other places across the country that are moving towards some kind of mobile mental health response so that there is mental health response as opposed to just police response or maybe instead of police response. But currently, most places don't have a 912, so to speak. There is no other system in place.
Asante, what's your take on that? Why do we call the police when somebody's obviously having some kind of breakdown or episode? Why police? Why not an ambulance? I mean, you've been in that situation with a family member.
I think one of the big reasons is that folks don't have any other option, and even when the options do exist, sometimes people don't know those options do exist. But I think really a big piece is, we treat police as a jack of all trades intervention service, and realistically, we haven't talked enough about mental health historically. Probably around the world, but even in recent history, the mental health conversation is just beginning. And because of that, we don't really have the infrastructure in place to, understand what's happening when someone is having an episode where, an outsider might think they're acting strange and don't know how to react, but also don't know who to call either in that situation.
Tim, I see you nodding. Go ahead.
Yeah, Asante brings up a really, great point that, aside from the lack of other resources, that might exist in a community, there is a lot of what we're seeing is a lack of understanding. That there's this assumption that because somebody is presenting a certain way in public, that they have done something bad, and that there's this morality that gets assigned to that presentation of a crisis. And so, as we're discussing this type of response, we need to really look at where things like morality, where our personal values and, implicit and explicit bias are playing into what we as bystanders or as community members expect to see, what kind of outcomes we become attached to when we see that crisis unfolding in the community. We call because we want to see a certain type of response. We want to see a certain type of outcome. And by and large, because that understanding isn't there, because there's maybe not so much compassion, generally what we want to see is just a removal of that crisis. We want that to happen somewhere else, not in my backyard. And so, I think that as we really look at what's another type of first responder we can bring into these situations, we also need to look at what we as community members, what we, our neighbors, are doing, and what is really happening when we do something like call the police when we see our neighbor in crisis.
Guests, can I share this thought with you? Kevin Kelly is watching on YouTube right now. Hi there, Kevin. Mental health professionals used to respond and society decided that was bad. Now the police respond and that's bad. People can't make up their minds. Pretty simplistic. Asante, do you want to work on that first of all?
Yeah, when I hear that statement, what it says to me is, what data are we collecting? What is the research? How are we evaluating what's happening in these calls? And that's something that we really try to, collect a lot of information on in the Reach Out Response Network. And what we're finding, at least here in Toronto, is that, the large majority of calls being made to 911 are mental health calls. And, we're receiving 30,000 mental health calls a year in the city. 10,000 of those are related to suicide risk. So when we really, look at the numbers, we start to think, the numbers kind of tell us what's needed and what's not for certain situations. And I think that's really important for us to, to draw from while we're making these decisions about what models we put in place and how we operate our cities.
It kind of speaks to, Amy, we've put the police in a really difficult position, haven't we?
Yeah, absolutely. Going back to what Tim said a few moments ago, in terms of we need to figure out as a community at large what our expectations are. Currently, the expectations that we have, whether we recognize those are expectations or not, because we've done that work to examine them or not, are not being met. And so we need to have, I think, a larger conversation about what do we want the response to look like. And we also need to talk about what is the, I hate to use the word problem, but what is it we're trying to address or solve? Oftentimes, the police have a certain amount of tools. Some of those are great tools. There's some great officers across the country. But sometimes we, as Asante said, we're being tasked with dealing with anything and everything, and we don't have every tool. We're not always the right response. And so when people's expectations in any kind of relationship, the relationship between the community and the police being no different, are unmet or misunderstood, I think we as police need to definitely do a better job of telling the story of who we are, why we do sometimes the things we do, why we don't do other things. I think those are some of the things that are missing from the conversation and helping us forge a path forward as to what we want as a community at large.
Let me share with you, Sparks Nevada Police Department, they had a community briefing and they said this was a 911 call that didn't go well and it was for a mental health emergency response. Let's have a listen to that call.
911, what's the address of emergency? Alarm level.
Rock Boulevard. My son has a gun in the car. He's trying to leave, and he's saying he's going to kill himself. He's mentally unstable. And he said he's going to die by cop or by himself.
Okay, what's your address?
Right across, right into the Drug Boulevard.
Ma'am, take a deep breath. So I can't hear you. So what's your address?
So the person who was having difficulties even articulated that he knew that if the police were called, maybe he would get to die by cop, which speaks to how wrong police involvement can be. Pedro Fernandez on YouTube says, I called the ambulance for my stepfather one time to take him to the hospital for a mental breakdown, and the police showed up and put him in handcuffs and took him to jail. Tim, you're talking about cahoots. How would they have dealt with that situation maybe differently?
Mm-hmm. So, I think one of the first things that I really need to establish is that, a crisis occurs when a need goes unmet. And what that need is, varies person to person, and what that response looks like in that actual crisis, varies person to person, day to day. But, on a very foundational level, with the cahoots response that we have here in Eugene and Springfield, Oregon, when that call is made to that public safety dispatch center and the cahoots goes out, our objective is to support and stabilize somebody, providing the least intervention necessary to really get them through that initial period of crisis. We're not going to be able to solve every problem. We're not going to be able to implement long-term solutions, but what we can do is work with that individual, recognizing that they're the expert in their experience, and that we as responders really need to listen to that experience, listen to the expertise, and then engage in a collaborative process that keeps that person empowered. And that keeps them in the position of autonomy, really being able to figure out what is it that is the most emergent unmet need, and what can be done to address that. Maybe it's 3 a.m. and there's not, that business isn't open, but we can still work together. We can still come up with a plan to support that person so that they can make it through until that more traditional resources opened up. There are a lot of situations where, yes, somebody does need to go to the hospital. That is the most appropriate outcome for them in that situation. And as such, the cahoots model of mobile crisis response really recognizes that there are going to be times where getting somebody out of that immediate situation where those triggers are, where there are other circumstances that allowed that need to go unmet, and so we will transport folks when needed. And that's, I think, the other thing that's really important is that when we're looking at these responses, when we're looking at who goes out, oftentimes folks might wait to call until it's too late because they're worried about that ambulance bill, or because they're worried about getting that huge bill when they go to the ER. And because folks can, because of that economic pressure can put those things off, if there's an alternative response that can come in before those crises have gotten to the point where the hospital is the only outcome that's really going to get that person through the night, keep them safe, then we're doing a lot better job. So, I wonder about, both with that caller in Sparks and then that more recent example, if there had been a resource, for somebody to reach out to before things got so emergent, would there have been a different outcome?
Yeah.
Yeah, Tim, as sorry, as I hear you speaking, it makes me think about, what happens when a police officer is showing up versus when a peer worker, a peer-led mobile crisis is showing up. And, we have these associations with the police officers that police officers show up when something is wrong and there is danger present, which sometimes just, the space or the environment that then occurs after that is, it lays the groundwork for escalation. If a peer-led response is, the first responder, the person or the people who are experiencing the crisis, whether it's a person alone or, their loved ones or the people around them, it sends a much different message about the situation and says, this is something that is manageable and something that can be de-escalated. and perhaps a further crisis can be averted, by the simple fact that you have someone who's trained, someone who might have lived experience themselves, someone who understands what's happening and what certain symptom presentations mean, and can properly respond to that in a way that maybe someone who doesn't have that wealth of experience and training, we're expecting a lot from police officers, may not have that training, and so things can go awry really quick.
Liz Rainey is
I
echoing your
know.
thoughts. Yeah, go ahead, Amy, go ahead.
I know in Olympia, I've been doing this a long time, and a couple of years ago when we started our downtown walking patrol, and granted, Olympia is 50, 60,000 people, so we're not huge. And we have a large unhoused population in our downtown area. Some of those folks have struggles with mental health issues. Some of them don't. But man, relationships have, which I think is what Asante is referring to a little bit. And our ability in our walking patrol unit has given us such a different kind of access. And the relationships have become so important. And he's absolutely right that when those relationships are established, there are people, a call may come to dispatch and I'll hear the description of the person or even just the location of the person. And I will know likely who someone is calling about. And also because I know that person, can usually make a pretty good guess as to what the solution is, what might be helpful to that person, if it's perhaps a more appropriate response for crew than it is for us to respond. And I think moving towards some more peer-based models is a direction that we should continue to look at and explore and expand. In Olympia, we have our crew team, and then we also have our familiar faces, which is very peer-based as well. And we have seen successes that if someone had told me 2 years ago, this is what we were going to see from those programs, I'm not sure that I would have believed it. It has been miraculous, if I can use that word.
We spoke earlier to Dr. Aku, who works with the New York Police Department, and she helps them with their training for mental health crises. This is what she told us earlier.
I work with the New York City's Police Department's hostage negotiation team. I teach them about mental health, mental illness, and de-escalation skills. De-escalation skills are using good communication skills to diffuse a crisis situation. The specific skills I teach are active listening. You have to listen to the person. We have 2 ears and 1 mouth to remind us to listen more than we speak in order to gather the information so that you can express empathy, which is skill number 2. Once you've expressed empathy, you're likely to have rapport. The person's going to start to trust you. They're going to start to calm their behavior down, and then you can work with them to find a positive outcome.
So Liz Rainey comments on YouTube. Hi there, Liz. In the US, we don't have or know who else to call for mental illness, and the way police officers are trained in general needs an overhaul, which Black Lives Matter movement has highlighted. Do you feel that the times are changing or changed, Asante, in the last few months?
No, this is a question I'm hearing a lot, and I would say yes and no. The big thing, obviously, is what happened on May 25th, which was George Floyd's murder, and that, started a conversation. And obviously, it's a very important conversation to have started, and a conversation that should have started long before, the events of that evening happened. But now here we are having this conversation, but it's up to us now to keep that momentum going. There's a lot going on in the world. Things are happening fast, and it's easy to forget what happened, even 2 or 3 months ago. That something that we should be continuing to talk about. But I think one of the outputs of, or one of the things that resulted from, the George Floyd murder and the things that have happened thereafter, is that we are having this conversation now about mental health and mental health crisis and what response to that looks like as well. And for me, it's very important that we continue to keep having these conversations everywhere, whether it's about mental health and mental illness, it's about racism, it's about police brutality. It's important that we keep having these conversations. And thinking about how we can turn these conversations into action.
There's one more thought I want to add to the conversation, guests, and I'm going to ask you, Amy, to come right off the back of this. This is Amy C.
When we're
Watson. She's
developing,
a social welfare professor for the University of Wisconsin-Milwaukee, and she's thinking about, that question I asked at the beginning. If it's the police don't respond, who will respond to mental health emergencies? Here's Amy.
when we're
Yes.
developing alternative services to respond to people experiencing mental health crisis, we need to make sure that we engage and empower the communities that are most impacted by over-policing to make sure that what we develop is responsive to their needs. One of the worries that I have as we're developing these models is, of course, we have to acknowledge that there may be some situations where police assistance is required due to an element of danger or some type of criminal component to the situation. However, I worry that our assessment of that risk could include some bias, and so that what we'll end up having done is provide alternatives to white middle-class communities and leaving communities of colors getting primarily a law enforcement response. That won't reduce race inequities, it'll actually increase them.
Amy, I interrupted your thought to bring in another Amy. Go back to your thought, and then that whole idea of, is there another way other than police? Are you happy to just hand over that responsibility to someone else? Is that possible?
Well, a couple of thoughts. Going back to my earlier thought, I really like the idea of engaging our curiosity. I think I would say this about myself. It's something I try to work on, and I think that we would be well served to become more curious. I think we've decided that we want to be really certain about things, and we've lost some curiosity. And I think if we were becoming more curious about our neighbors, and I see everyone as my neighbor, and getting to know them and figuring out what their perspective is, what their experience has been, that could help me be a better neighbor to them, whether that is in a personal aspect or a professional aspect. As far as handing everything over, I think that she acknowledges, and I would agree, that there are times where there may be an element where police assistance is required. I think the appropriate response should be who has the right tools to address what we're trying to address. Sometimes that may be the police. Oftentimes it may not be the police. Maybe it is a combination of both. I think we also really like things to be an either or, because it's easier, I think, for us as humans when it's very clear and bright lined, but people are complex and they're complicated. We're all complex and complicated, and there's lots of shades of gray in our life. And so who has the right tool? And maybe it isn't an either or. Maybe it's not the police or mental health. Maybe it's the police and mental health. Maybe it's the mental health and some other social service provider. It doesn't have to be an either or. We don't have to I think what we've run into is that we think one system or one plan can fix and address everything. And we're way too unique and interesting for one plan to fit all.
I'm just thinking, Asante, because you understand mental health from the inside. And I'm wondering if you had a friend or a family member who was having an episode, they needed help, would you tell them to call the police?
That one is very touch and go for me. I think it would depend on, exactly what's happening. Luckily, because of my knowledge of, mental health and, the system here in Toronto, I'd probably be able to help them with, what might be safer alternatives. I grew up in urban communities. A lot of, my friends look like me. Family, obviously, same thing. So, even going back to that clip you played from, I think she was a social worker in Milwaukee. I've thought about that a lot in terms of, how different communities will be responded to, and what Amy was talking to about. There is no one size fits all option, and Yeah,
That's
and I think what
that's where we're going to leave it. We can have this conversation for many hours, but I appreciate the takes that you shared with me in this half hour on the stream. Asante, Tim, Amy, thank you very much, and YouTube as well. Appreciate your comments. I'll see you next time.